Do you know the warning signs of throat cancer? It's a question that's more crucial than you might think. Many of us are unaware of the symptoms, yet early detection is key in battling this disease. Being informed, understanding the signs, and seeking medical attention when something seems off can make a world of difference. It's not about fear, but about empowerment through knowledge. So let's dive into this important topic. Wouldn't you like to be equipped with the knowledge that could potentially save your life? One of the first warning signs is a persistent cough. This isn't just any cough. It's persistent, lingering, and may even bring up blood. Imagine a cough that doesn't seem to want to leave, a cough that becomes part of your daily routine. It's more than just a nuisance. It's a potential alarm bell. It's your body's way of saying, hey, something's not right here. Blood in your cough is especially alarming. If you've been coughing for weeks, it's time to see a doctor. Have you noticed any changes in your voice recently? A sudden shift in the sound of your voice, like persistent hoarseness or difficulty in articulating words clearly, could be more than just a passing cold or strain. These changes might be subtle and seemingly harmless, but they could be symptoms of throat cancer. Pay attention to your voice. Are you having trouble hitting those high notes in your favorite song? Or maybe your coworkers are asking you to repeat yourself more often. Don't ignore these changes. They could be telling you something important. Are you having trouble swallowing? This isn't about the occasional food going down the wrong pipe. We're talking about consistent difficulty or discomfort when swallowing. It might feel like your food is stuck in your throat or chest. Imagine a sensation of a lump that never quite goes away. This could be a warning sign of throat cancer. It's important to remember, swallowing should be an effortless, natural process. Swallowing should be easy and painless. If it's not, that's a sign something might be wrong. Have you been losing weight without trying? Unexplained weight loss can be a bit of a mystery. It's not always about being on a diet or hitting the gym harder. Sometimes it's a symptom of something more serious, like throat cancer. When your body is fighting a disease, it burns more calories than usual, leading to weight loss. So if you're shedding pounds without changing your diet or exercise habits, it might be time to check in with your doctor. Is your sore throat just not going away? Let's delve into this. A persistent sore throat is more than just a nuisance. It could be a red flag pointing towards something more serious like throat cancer. This isn't about the occasional irritation or a sore throat that follows a cold. We're talking about a constant sore throat, one that lingers and doesn't improve. Remember, it's not about creating panic, but about promoting awareness. If your sore throat is persistent and unexplained, it's better to be safe and get it checked out. Are you experiencing ear pain? It might seem disconnected, but ear pain can indeed be a symptom of throat cancer. This is because the throat, ear, and neck are all interconnected, so a problem in one area can cause discomfort in another. If you're noticing a persistent or unusual earache, particularly if it's combined with other symptoms we've discussed, it might be a sign of something more serious. Remember, pain is your body's way of telling you something is wrong. Have you noticed any unusual breathing sounds? When we say unusual, we're talking about sounds that are not typically associated with your normal breathing pattern. This could be a high-pitched, whistling, raspy, or wheezing sound. What's happening here? Well, these sounds might indicate that there's an obstruction or narrowing in your throat, which could potentially be a sign of throat cancer. Remember, your body uses these sounds to communicate that something isn't right. Unusual breathing sounds should never be ignored. Have you discovered a lump in your neck? While it's common to feel alarmed, it's crucial to remember that not all neck lumps are cancerous. However, a persistent lump could indicate a potential sign of throat cancer. This might be due to an enlarged lymph node, where your body is fighting an infection, or, in rarer cases, a tumor. It's always better to be safe than sorry. Any lump or swelling in the neck warrants a visit to your doctor. Are you having frequent nosebleeds? It may seem unrelated, but it's essential to pay attention to this warning sign. Frequent nosebleeds can be a sign of throat cancer. This is because the tumors in the nasal cavity, throat, or sinuses can disrupt the normal blood flow, causing nosebleeds. This symptom is more common in certain types of throat cancer, such as nasopharyngeal cancer. Remember, these nosebleeds aren't your average, occasional nosebleed. They are persistent and recurrent. Frequent nosebleeds are not normal and should be checked out. Are you suffering from constant headaches? This throbbing discomfort might be more than just stress or lack of sleep. It's worth noting that constant headaches could be a symptom of throat cancer. This happens as the tumor grows and puts pressure on nerves and blood vessels in the head and neck region. It's not the most common symptom, but it's one that shouldn't be ignored. If headaches persist, it's crucial to talk to your healthcare provider. Persistent headaches should be addressed with your healthcare provider. So those are the 10 warning signs of throat cancer you should not ignore. From a persistent cough and changes in your voice, to difficulty swallowing, unexplained weight loss, a constant sore throat, ear pain, unusual breathing sounds, a lump in the neck, frequent nosebleeds, and constant headaches. All of these signs are crucial to be aware of. Early detection is key in the fight against throat cancer. Remember, being aware of these signs and seeking medical advice early on can be life-saving. Don't ignore the signs your body is telling you.